7-OH is not just like an opioid. It does not just have opioid binding properties. 7-OH binds to the mu receptor, which means scientifically, by definition, it is an opioid. And yet it is sold in vape stores, in smoke shops, in convenience stores, and gas stations that are popping up all over the United States, and nobody knows what it is. It is a synthetic concentrated byproduct of kratom. Our focus is not on kratom. Our focus is on 7-OH, which, according to the Journal of Medical Chemistry, is 13 times more potent than morphine. We have a history in public health of being asleep at the wheel. 30 years after cigarettes were widely used, then we started raising public health concerns. After heroin, crack, cocaine, and other street drugs became popular, about 10 years later, the medical establishment and public health community responded. 18 years after the approval of OxyContin by the FDA, we woke up to a terrible crisis that may have killed almost 1 million Americans. And then again, right afterwards, with fentanyl. We have a history of being asleep at the wheel. For the sake of our nation's children, let's not get caught flat-footed again. Public health is supposed to prevent disasters, not just clean them up after they killed thousands and thousands of people. Why do we get caught flat-footed time and time again? In my opinion, it's because of a disconnect between the ivory towers and the streets. Have experts been to the vape stores? It affects what we see in the operating room. I learned from living and working in inner-city Baltimore that you have to be proximate to a problem to understand it. We can't just talk about it on panels at medical conferences and in the ivory towers of the medical establishment. I saw on the streets of Baltimore how some of my patients that I would bump into switched from the prescription opioid that I would prescribe to heroin because they couldn't afford the copay. I've been surprised going to these vape stores at what I'm seeing. First of all, roughly 85% of the vape products are illegal vape products. We know that because the FDA publishes a list of legal vape products, and no cutesy, fruity flavor designed to appeal to children or a video game vape product device is legal or approved by the FDA. I've been surprised at the candies and gummies and drinks and ice cream cones. Here's one drink with 7-OH in it. There are other products that get added to drinks. Do we understand what 7-OH is at public health scale? Let's not get caught flat-footed again. We're not targeting the kratom leaf or ground-up kratom. We are targeting the concentrated synthetic byproduct that is an opioid. The Trump administration is deeply committed to preventing another wave of the opioid epidemic. And this is deeply personal for many people. It's deeply personal for the Secretary of Health and Human Services, who will share how at a young age he struggled with addiction. It's personal for a family friend, a good family with a good kid who is addicted, knows they're addicted, wants to stop their addiction, but can't stop. That story is going on all across the United States, and we don't have research or numbers or statistics on the scale of that problem. Let's not allow another wave of the opioid epidemic to catch us blindsided again. I've met some of these families. Let's be honest, there's also a lot we don't know. This may be the calm before the storm. It may be the tip of the iceberg, but let's be aggressive and proactive. Today, the FDA is announcing that we are initiating action to recommend scheduling of 7-OH as a controlled substance by the DEA. We are also releasing a report on 7-OH to educate the public, including the other names it goes by. And finally, we need to educate the public, including the medical community. I've talked to many doctors who don't know what 7-OH is. We need to be proactive so we don't get caught blindsided again. Thank you very much.